Hey, this is Doug Field, and welcome back to Healthcare Consumerism Radio. Instead of talking about certification, we'll turn the discussion to pharmacy benefit management and consumer engagement. And
got to be flexible.
Yeah, joining us this morning is Dr. Sumit Dutta, who's Senior VP and Chief Medical Officer with Catamaran Corporation out of Chicago. Good morning, Doctor.
Thank you for having me.
Yeah, we appreciate you being here and joining us. For our audiences, give them kind of a brief overview of Catamaran's position in this space. I know you guys have been very active in acquiring and, growing your business. So acquiring businesses, tell us, who you are and what you're doing.
Sure. So we are a pharmacy benefits manager, a very large one, and to your point, one that's been growing very, very rapidly. The company, when I joined just a little over a year ago, was at $4.4 billion. We stand at about $12 billion in revenue today, and with our recently announced Cigna 10-year deal, we'll be at a revenue number much larger than that. We've been adding employees at a rapid pace. We're at about 4,000 employees currently, and we're one of the largest PBMs in the country.
What do you see, Doctor, what do you see ahead as the opportunities and challenges for PBMs?
Well, I think the opportunities really tie well to what the subject of your program has been about, and it's really engaging members. Mm-hmm. I think that we're in a world that's changing dramatically from where it used to be when I joined this industry so many years ago after practicing medicine and joining Medco in the sort of early 2000 time frame to today, where the member and the information the member gets, their ability to make decisions and ultimately impact healthcare outcomes, that transition is happening as we speak.
Doctor, this is Ron Bachman. You mentioned you worked for Medco in the past. I saw that in your resume. A lot of people are familiar with the brand Medco and Express Scripts and a lot of the names that have been there. There's been some mergers in the industry, those sort of things. Catamaran, and maybe it's my own personal ignorance, doesn't quite have that recognition. But you're an enormous organization, and you're dealing with a high percentage of the marketplace. Can you tell us a little bit more about how you would compare to some of the other maybe names that people know out there, and are you doing a little bit more behind the scenes with the relationships like you just talked with Aetna, and somebody else is using your services but branding it in their own way?
Sure, and I mentioned Cigna just for point of clarification, but let me give you a brief overview that might help your audience. So Medco, of course, doesn't exist as a company anymore. They were purchased by Express Scripts. The other major competitor, I would say, a couple anyway, but is CVS Caremark. Mm-hmm. And then, of course, you have United's PBM. So let me just sort of outline the industry and then talk about Catamaran, where we fit in.
Right.
And then maybe address for a second why the name may be not as familiar to you as those brands that have been in the marketplace for quite some time. So Medco and ESI both are tremendous PBM driven by mail service. Mail service is a significant part of their business. They have high mail penetration rates. And, of course, CVS Caremark is the competitor in the marketplace where it is a retail chain PBM combination. Mm-hmm. And then, of course, United's offering is the health insurer United PBM offering. Catamaran is different in that distribution is not a driver of our solutions. Mm-hmm. So mail service, we have mail service and we have specialty pharmacy for those clients that prefer not a heavy mail service penetration as their way of engaging members. And mail service rates are coming down in any case as a percentage. Our solution works for them if they're retail agnostic and that they don't want to work with one retail chain, but a broad array array of retailers. Then we're the PBM that works that way. And then similarly, we're not connected with any one health plan. We have many health plans that are our clients. As far as the name goes, Catamaran was branded, I'd really say rebranded, only about a year ago, the summer of 2012, when two PBMs that your audience may be more familiar with, SXC Health Solutions and Catalyst, combined.
Okay.
So the name has been in the marketplace for about a year now, a little over a year. However, the PBMs behind it have been in the marketplace for a long time.
Gotcha. That's very helpful. I think everybody can better understand who you are and how you fit into that whole system there. So how are you engaging your individual members in an effective way?
Sure. So there's two major ways that we're focused on members. And one is to really offer a myriad of ways to connect. We're very nimble. Our heritage as a PBM is as a technology company. We provide, SXC anyway, Legacy was a claim system provider before they moved into the full-service PBM world. So we use that technology advantage to offer a myriad of ways for our patients to connect with our company. So let me give you one example. We just released what we call Briova Live, and that is essentially patients' ability to FaceTime, Skype, that kind of video connection with our specialty pharmacy. And I'll give you an example, having been involved when Medco bought Accredo in running their injectable and oral business. When a patient gets diagnosed with, let's say, multiple sclerosis or rheumatoid arthritis, and they're facing learning about this new diagnosis and having this chronic disease, and then maybe even having to inject themselves, the specialty pharmacies train these patients on both side effects as well as how to inject themselves. We have introduced the ability for these patients, for those who choose, to connect with us through, again, FaceTime or Skype. And then they have the ability to watch that process. Our pharmacists take them through that process, and we're introducing things like the ability to report them. So imagine when you get diagnosed maybe with some condition. It's very frightening. You don't remember everything that you're hearing. The ability to call back that interaction that you've had with the pharmacist and then review that, and then be able to use it at the time that you next have to do it or the time after that, is very, very powerful. And we have constant innovation. In fact, just a devoted innovation lab to continually develop and introduce new methods like that as an example. The second thing that we're doing, and I'll just quickly say this, is a tremendous investment and focus on not just reporting, but really predictive analytics. So moving away, our healthcare clients have a limited resource to invest, let's say $1. And what they want us to do is figure out who we should invest that dollar on. And with some of our predictive analytics capabilities, that's the kind of work we're doing. So those are the two areas.
Well, it sounds like it's a very personalized, consumer-centric type of an approach, giving people options and choices that they seem to want in their health care and in their pharmacy benefits that they'd utilize. What kind of cost savings does that generate when you get people involved very personally like that?
Well, I can tell you that in 2012, that's the full last full year of data that we have, that our drug trends, so our payer spending year over year on drug medication, was 2.6% in our commercial business. And when they used a full suite of our products, that was even lower at 1%. So in an era where rates of drug spend increasing higher and higher each year, particularly in specialty medications where they can often reach 20% or more than 20%, these suite of products and the ability to engage members and provide information provide true value. The other metric that I gave you is generic dispensing rate. As so many drugs are generic, when there's an opportunity to take a generic over a more costly brand drug, savings come back to our plans. And here, our generic dispensing rate is at the 82% level across our book.
Doctor, this is Doug. There's a lot of discussion and a lot of initiatives around transparency in this space. What are you doing around transparency? I mean, some of this touches on it. What else are you doing around transparency?
So transparency is when I look at transparency, I look at transparency in two different ways. So transparency is one to the consumer, so that they have a better idea of their costs. I'm going to spend a little bit of time on that. And then there's transparency in the relationship that you have with your clients, so that they understand how the benefit works and how the services are paid for. So on the latter, the quick subject is we are a PBM that puts together relationships with our clients in the way that they want them. So for those that are looking for what is, full transparency, it's somewhat hard to define, but we have these kinds of relationships. We have more traditional relationships with our clients. That is really purely driven by how the client wants to drive that. I think the interesting thing is transparency as it comes to the consumer today, and here I'm just very interested, because when I started in the industry, it was really more about utilization management. How do you utilize drugs? Because patients didn't have full transparency into the cost of their medication. In fact, it's a funny market. I'm sure you guys have thought about it. It's a market where normally the consumer drives demand, but this is a funny situation where the provider drives demand. Maybe the specialist is recommending tests that the consumer doesn't know the cost of or the outcome of, and that's a driver of demand. So what's fascinating is, how do you provide more transparency to the consumer so they can make better decisions? Let's say they've got a high deductible plan like I do. I care about how this money is going out the door. And so our mobile application is just one example of how we're providing information to the consumer real time so they have greater transparency into the costs. And we're actually using some kind of novel, neat techniques. An avatar, you'll be seeing an avatar called Catamaran Cat, that will help our consumers and engage them around some of these costs and transparency around.
Doctor, we've got about 20 seconds left, so can you tell our audience how they can find out more about Catamaran, and we appreciate you being here.
First of all, thank you again for having me, and I appreciate the opportunity to talk. You can certainly go to our website, and Google Catamaran Rx, and you'll find our website there, and gain more information. There'll be the ability to connect into our company and learn more about us that way. Right. And I am really looking forward to your listeners doing that about us.
All right. Thank you, Doctor. And to our audience, stay tuned for the next segment of Healthcare Consumerism Radio.